everybody. My name is Dr. Bryan Langlois, and I'm the Medical Director and Staff Veterinarian here at the Pet Pantry of Lancaster County. I'm also a member of the Pennsylvania Veterinary Medical Association and have been since I graduated back in 2005. And we're into the month of February, and everybody kind of sees February, of course, as really bad, sometimes frigid winter weather if you're like us in the Northeast, as well as Valentine's Day, definitely. But one other important thing about February as far as your pets are concerned, it is Pet Dental Health Awareness Month. And this is very important because we do find in veterinary medicine probably one of the most neglected areas at times are our pets' mouths. And that's for a couple of reasons. It's not something we always think about. And also, even if we want to check their teeth, some animals are not what we would call keen or amenable on having that done all the time. So it is an area that sometimes you can see a little bit more of infections and chronic issues kind of developing before you really notice a problem in your pet. So we're going to talk a little bit about that over the next couple of minutes as far as things that we worry about, signs that you can look for, some preventative things that you can help do, and finally just kind of what's going on when we do a dental procedure on your pet, because I know some people are very worried about that. So the first thing we're going to talk about is just some simple signs that you may notice. And of course, the first one that everybody usually brings their pet to the vet for is halitosis, or really bad breath. That's the one that's most noticeable. You sometimes can smell your dog from across the room, or if they come up and give you kisses and things like that, and you're just like, oh God, don't do that, I'm going to vomit now. That's usually the first sign, and a sign that you want to take them to the vet and have that checked. There are some other, more subtle signs. Sometimes dogs or cats that are a little bit more reluctant to eat. They seem interested in eating, they have an appetite, but they just really don't want to eat because a lot of these conditions are very painful in their mouth, and they remember that. They may not be interested in chewing on a harder treat like they used to be. They may drop a little bit of food. They may, eat a little bit, but then some of it falls out just because it's more painful for them to fully close and chomp down on something. And finally, you may notice the fact that, they may be drooling a little bit, especially in cats. We do find that a lot of dental issues are related to drooling in cats. So if you do notice your cat drooling a lot, you may definitely want to have their teeth checked. And of course, if everybody is taking their pet to their vet once a year for yearly checkups and things like that, your vet's obviously going to look in there too and hopefully can head off some of these issues that go on. Now, there's a ton of different dental issues that can happen in your dog or cat, and there's a lot of different complications that may be able to arise. A couple of them that we're going to talk about real quick or mention. Obviously, the first one is pain. Some of these are incredibly painful conditions, and I'm going to explain how in a second. You may also notice infection spreading throughout the body through the bloodstream. If you have really bad bacterial infections on your teeth, that can get into the bloodstream from the gum and then go to organs such as your liver or your kidneys in your pet, and that can really be a problem. Same as it would be in us. The same kind of dental concerns go both ways. So those are certainly some things to be concerned about. I'm going to talk about very quickly two specific conditions that we do see, one in cats, one in dogs, just to make you aware of how serious some of these things can be. And the first one, and as you can see kind of by the video playing over my shoulder right now, is something called feline resorptive lesions, or feline oral resorptive lesions. There's a lot of different names for it. And what happens in this is an incredibly painful condition in cats. And what happens is basically where the tooth meets the gum, for some reason, and they're still not quite sure why this occurs, but you do get a lot of erosion of the tooth itself, kind of right down into the pulp cavity and stuff like that. It makes the teeth very brittle, and it is incredibly painful. And as you can see, when we're kind of probing that area, this is a cat that is under a surgical plane of anesthesia right now. We're about to do a dental on him. And you can see the pain sensation and the nerve sensation from us just tapping on that is still so severe that the body reacts. So you're going to see that jaw chatter a little bit. And it's something you may notice, just in your own cat when they're eating or something. They may chew a little bit and their jaw may chatter a touch. That's a sign you definitely want to have something seen, because this is an incredibly painful condition for cats. And the only thing we can really do at that point is remove those teeth that are, suffering from the resorptive lesion. So that's something to remember in cats. Now in dogs, as you're going to see another picture fly up here in a second, basically we worry about what we call tooth root abscesses. And specifically in dogs, we do see some premolar tooth root abscesses that present in a very odd way. And that's usually with swelling and maybe a little abscess or cystic type thing up near their eye. It's actually not draining into their mouth. The infection kind of creeps up through the gum and ruptures out through the eye area. And again, that's something that can be taken care of. We do treat it, but it is something to be aware of. So if you start to see a swelling like that in your pet, you definitely want to have their teeth checked, not just the area itself on the skin, because we will usually have to go in and remove that tooth, and that usually takes care of the problem. So those are just two quick things. Like I said, there's a myriad of other things, tooth fractures, things like that, but certainly everything can happen in your pet. But those are just two examples of why it's so important to take care of your pet's oral health in addition to the rest of their health. So we've talked a little bit about, things that you worry about when, you come into dental health and stuff like that. And you may also hear your vet describe something called grade 1, grade 2 dental disease, or grade 3, grade 4 dental disease. I know a while ago it was in the news and everybody thought it was this horrible thing. It's a descriptive term that we as veterinarians use, and it's different classifications. And as you can see, again, as the picture's going through, we just use it so that we can stage exactly how bad your pet's teeth are. Hopefully they're perfect. But you can go from grade 1, which is a little plaque buildup, maybe tartar, all the way up to grade 4, which is really severe, and you get a lot of this really thick calculus stuff that's kind of hardened plaque and tartar, really disgusting, harboring a lot of bacteria, signs of infection, food particles, things like that. And these are the ones where the mouth really starts to stink. And obviously when you get to stage 4, we really do worry that you have a lot of gum resorption going on around the tooth. The teeth get very loose, and you really do worry about severe periodontal disease at that point, and a lot of these teeth actually usually do have to be pulled. And it is something that sometimes does happen, especially if maybe you rescued a dog and this is the first time you're having it looked at. But keep an eye on your dog's teeth and cat's teeth. You really don't want it to get to that kind of level that can be really severe. So if you do hear your vet talk about grade 1 to grade 4 dental disease, things like that, it's a descriptive term. It's not technically a disease that's riddling through your pet. Again, it's just what we use to describe things. So that's another pointer to kind of think about. So the last two things I'm going to talk about really quickly are, one, so what can you do as a pet owner to help kind of prevent things from getting this bad, or needing major dental prophylaxis or dentals being done at your vet's office? I will say that in some animals, teeth in animals can be teeth like in people, and genetics can play a huge part in it, which means you could be brushing your dog's teeth every day or your cat's teeth every day, doing everything you can, giving them those supplements that go in the water to kind of flush out their mouth, and they still may have teeth that need to come out. You're not doing anything wrong in that situation. It's just like a person who goes to the dentist every 6 months, brushes, flosses twice a day, does everything perfectly, and they still have 10 cavities or something like that. Some of it is just genetic. And we do find that the smaller breed dogs, of course, tend to be a little more prone to these dental issues than the larger breed dogs. And that just is a breed differentiality, really, if that's a word, and I think I just made it up. But anyway, so just be aware of that. You may be doing everything perfect, and you still may have a little bit of those problems. But as far as things you can do, a lot of people talk about brushing your dog or your cat's teeth. And really, that's a good thing that can be done. And there's a ton of different types of toothbrushes, the finger toothbrushes, the regular toothbrushes, all of that stuff. I do want to give a couple of pointers on this, and the first is you definitely want to start them young when they're puppies and kittens so they get used to their mouths being worked with and their teeth and gums being touched, because it's much easier to get them used to it than when they're, a 100-pound Rottweiler that doesn't see the humor in what you're trying to do. So keep that in mind. You also want to start slow when you're doing these things. So maybe one tooth and then reward your pet with a dental treat or something. Make it a very positive experience for your pet. Don't really try to, do everything at once really forcefully. You can traumatize them. If you do notice when you're brushing their teeth any blood or pain that your pet may seem to be associated with, stop. Contact your veterinarian. They have to look at that mouth. You really don't want to keep going for two reasons. One, you might get bit and it may just be a straight pain response. And two, it may be something that your vet does have to look at. So remember that as well. As far as toothpastes go, the big thing that I will tell people is you cannot use human toothpaste in your pets. If you think about it, it's sort of like the same thing when you see on the labels on there, young children have to be supervised so they don't swallow a lot of it. There's fluoride in this and there's some other chemicals, things like that. We don't want them swallowing it because it can potentially, cause a lot of gastric upset, and if a ton is swallowed, be a real health risk to your pet. We obviously can't get our pets to rinse out their mouths and spit after they're done. If you do have a pet that can do that, I want to see that video because that would be the first I've ever seen. But just kind of keep that in mind. And of course, when there's a need, the vet industry comes up with a solution. And there are pet dental toothpastes out there that work with very enzymatic action, and they're okay if your pet swallows it. Usually they're flavored beef, chicken, something like that to make it more of a positive experience. So remember those things. The dental treats, they do work, and a lot of it is just the mechanical abrasion. It's just, when I'm chewing on it, it's working its way, almost like flossing, kind of getting into those tough areas when they're chewing to kind of break down some of that tartar and plaque and get it off. So dental treats certainly are fine. They're a lot larger, especially the dental kibbles that are out there are a lot larger for that reason. So it forces the dog or cat to crunch them to kind of clean some of that, tartar and stuff off the teeth and gums. You certainly can use some of the oral rinses that are out there. There's no problem with it. Some of the things that go in their water to freshen the breath and maybe protect things. There's no harm in doing it. It may not be as great as brushing, but you certainly can try it if that's the only thing, your pet will allow you to do. So those are some things that you can do as far as prevention goes. The final thing I'm going to talk about is just basically what happens when the veterinarian says, you know what, we really need to have your dog or cat in. We've got to do a full dental. It'll make them feel a lot better. So what happens in that process? And, a lot of people are a little bit nervous about putting their animal under anesthesia, and obviously we have to do that because we can't get them to stay perfectly still, and we don't want to, obviously have to try to do a less of a good job because they're awake. So we do have to put them under an anesthetic. The anesthetic is very, very safe, and obviously we will do all of the precautionary measures, potentially blood work, obviously a full physical, things like that, before putting your pet under anesthesia to make sure that they are a healthy enough candidate to undergo anesthesia. Once under, the first thing that's probably going to happen is just a general cursory look at all the teeth to see what's going on, and they're going to do a set of dental x-rays, and most vets will obviously show you that to show you if there's problems, and we get a real good look at the root structure to see if we actually do have to pull a tooth because of something going on below the gum line that we can't see. After that, we're going to turn to our trusty friend right here, and this is typical dental unit. You would see it in most veterinary practices. You would also see it, same sort of thing you would see in your own dentist office if you went in for a dental cleaning. And first thing we usually do, we'll pull this out. This is just an ultrasonic scaler. We're going to scale away a lot of the plaque and tartar that's on the teeth. After that, we're going to make sure that there's no pockets anywhere or other things that are concerning as far as infection or loose teeth that have to get pulled. We'll obviously take care of that. After that, we'll go on to a little bit of polishing and make your teeth look all pearly white. Then kind of clean everything off with a little water and a little air, and again, double check to make sure that there's no problems. And a lot of vets will actually take before and after pictures, both for the record and to show you how much of a difference going through a full dental does work for your pet. The final thing that they may do is put a little bit of what we call dental sealant on the tooth, and this just kind of helps protect the teeth a little bit more, since obviously if you can't brush your dog's teeth every day, it just provides a little more protection against the daily grime that will build up and things like that. So that's kind of basically what a dental is, and then the animal will wake up and you'll probably pick it up that same day. You might be sent home with some antibiotics, and you definitely would probably be sent home with some anti-inflammatory and pain medication if it was a situation where teeth were pulled, so this way there's no pain post-operatively. And you may be asked to kind of give them more of a softer canned food diet for a couple of days, just until the gum areas where the teeth were pulled were healed down, and then they can go back to eating their normal diet. So that's the short version of basically what happens with a dental procedure of your pet. And I know it can seem a little expensive for some people. You have to talk to your vet about that. Maybe you can work out something where a payment plan can be done. Or, as I've mentioned in other videos, a lot of pet insurances will cover dental prophylaxis. And it's been shown if people have pet insurance, they are much more likely to go ahead and take care of their animal's teeth and be reimbursed for that cost, and it actually does help the animal a lot in the long run. So definitely look into pet insurance. Obviously, Pet Plan is the one that the PVMA endorses and works with. They're a wonderful program to work with, and they actually do have plans for this. So definitely check it out. PAVMA.org. You can certainly learn all about it as far as pet insurance goes, and you do get that discount if you sign up through the PVMA. So best of both worlds for you, your wallet, and your pet. And so, those are just some things to keep in mind during Pet Dental Health Awareness Month here. Again, if you do have any major questions, always contact your veterinarian about your pet's oral health and tooth issues. They're the ones that can provide the best information out there and definitely provide the best care for your pet. So this is Dr. Bryan Langlois with the Pennsylvania Veterinary Medical Association reminding you once again, you always want to take your pet to the vet, not the net.